Wernicke's disease, a common and preventable neurological disorder caused by thiamine vitamin B1 deficiency. While alcoholics account for most cases in the United States, patients with malnutrition from various causes are also at significant risk.
At-risk populations alcoholics account for most cases in the United States due to poor nutrition and impaired thiamine absorption. Malnutrition cases, patients with hyperemesis, starvation, renal dialysis complications, chronic illness, cancer, and AIDS patients experiencing severe nutritional deficiencies. The classic clinical triad, ophthalmoplegia, eye movement disorders, including horizontal nystagmus, lateral rectus palsy, and conjugate gaze palsies, ataxia gait instability resulting from polyneuropathy, cerebellar involvement, and vestibular problems. Global confusion, profound disorientation, indifference, and inattention, rarely progressing to agitated delirium. Clinical presentation reality. Most patients are profoundly disoriented, indifferent, and inattentive, though the complete classic triad appears in only one-third of cases. Without treatment, the condition progresses rapidly. Ocular abnormalities include horizontal nystagmus, bilateral lateral rectus palsy, and conjugate gaze palsies. Pupils are usually spared, but may become myotic in advanced disease. Additional symptoms include tachycardia, postural hypotension, and other manifestations of nutritional disease like polyneuropathy. Disease progression without treatment. Initial symptoms: disorientation, indifference, inattention, ocular motor abnormalities. Progressive deterioration, stupor and decreased responsiveness to environment, advanced stage coma, and potential death if left untreated. Recovery timeline and outcomes. Ocular palsies improve rapidly after thiamine administration. Ataxia improves more slowly than eye movement disorders. Apathy, drowsiness, and confusion resolve progressively. Half recover incompletely with persistent gait problems. As acute symptoms recede, an amnestic state may become apparent, potentially developing into Korsakoff psychosis with persistent memory impairment, confabulation, and disordered temporal sequencing. Brain pathology, paraventricular regions of diencephalon, midbrain and brainstem structures, superior vermis of cerebellum, dorsal medial nuclei of thalamus, pathological changes, symmetric discoloration around ventricles, petechial hemorrhages in acute cases, mammillary body atrophy in chronic cases, endothelial proliferation and demyelination. Pathogenesis, the biochemical cascade. Thiamine deficiency impairs function of key enzymes, transketolase, pyruvate dehydrogenase, and alpha-ketoglutarate dehydrogenase. Metabolic disruption. Diffuse decrease in cerebral glucose utilization leads to mitochondrial damage. Glutamate accumulation, impaired alpha-ketoglutarate dehydrogenase activity causes glutamate buildup. Cell damage energy deficiency combined with glutamate excess results in excitotoxic cell damage.
Emergency treatment protocol. Wernicke's disease requires immediate medical intervention to prevent irreversible damage. 50 milligrams thiamine intravenously or intramuscularly, given daily until normal diet resumes, must be given before intravenous glucose solutions to prevent precipitation or worsening. Key clinical takeaways. Wernicke's disease is entirely preventable with adequate thiamine intake and early recognition of at-risk patients. Only one-third present with classic symptoms. Maintain high suspicion in at-risk populations. Always administer thiamine to alcoholic patients before giving parenteral glucose solutions. While ocular symptoms improve rapidly, cognitive and gait problems may persist long-term.